Thank you, everyone. Welcome back. Yesterday, a range of online workshops took place to identify youth health priorities and hear from young people about what was important to them and how they thought the problem could be fixed. So I'll now hand over to Adam Drake from Balanced Choice and Dr. Renee Kirkham from Menzies School of Health Research to lead this session on youth feedback.
G'day, beautiful people. Wonderful to be with you all, and just want to acknowledge the Larrakia people whose country we're on, and just a massive thanks to elders past and present and all the crew that allow us to do the work with the young people here to create a beautiful environment. And such a privilege to work alongside Menzies and all this great young, we call it the Youth Committee, that's been joined together by Menzies to gather information from young people. And as soon as we got thrown the curveball of COVID, it was that thing of going, well, what do we do now? So, Renee, it's been quite interesting. I can see you there too, Rachel. So if you want to say a quick hello.
Hey, thanks, Adam. Hi, everyone. Look, yeah, it's been an incredible couple of days. I have to admit, I've been out of action raising a baby this year, so I've just sort of stepped in at the last minute. But what I do have reflected on is we've just got such an incredible powerhouse of young people in the Territory that we should be so proud of. And it's just an awesome opportunity once again to hear from these young people and to get their priorities on the board.
Yeah, awesome. And today, you know, there's no point spending too much time with the 45-year-old with dreadlocks. It's important to hear from the young people. But if we actually looked at those YouTube clips, they'd give you a good idea of the 4 categories that got broken into based on what the young people were saying were important to them. So just to let you know what those categories are, the first one was mental health. The second one was sexual health. The third one was access to health services. And the fourth one was environment. So each one of the youth committee members went and spent time in those groups yesterday. And what we did in those groups yesterday is we had an icebreaker to try and, you know, start to feel comfortable being online together, because we all know how weird that can be. And then after we did that, we asked them why the topic was important to them. Then the committee broke the groups into crazy threes where they came up with ideas and solutions around this. And then I put on a suit jacket and a tie and pretended to be a government official. I wouldn't say who that was, whether it was the chief or whoever. And they fired questions and demands for what they wanted. So we called them the demandments. So now we're going to spend 5 or 6 minutes with each one of those group leaders and find out a little bit about what information they gathered. So I want to introduce the amazing Portia and Jaylene. How are you both?
Good. How are you?
Hi.
Good to see you online. You did an amazing job yesterday. We might flick straight to the big word cloud. And I know Josie Povey's running this from the background, so she'll flick that up there so we can all see it. And I'll get you two to just talk through the word cloud. Now, that's not quite the word cloud yet, but I'm sure it's coming. But do you want to tell me briefly before the word cloud pops up just how you found yesterday?
Yeah, yesterday went good. The session was very interactive, and we went through a lot of discussion that is important to talk about today, I think.
Yeah. So if we look at the word cloud there, Portia, do you want to just explain it, some of the words there?
Yeah. Well, the big words that you mainly see is like things like awareness, mental health, stigma. Stigma actually comes up twice. Anxiety, shame, and stuff like that.
It's interesting, stigma came up twice. I was saying yesterday, I actually had to go and look it up to see exactly what it meant. So that was a little bit out of my depth there. So you can see this brilliant stuff there. But what I was really interested in is we asked them why was it important to them. And there were so many passionate responses from the young people, which led to what we called the demandments. So we might go across to the demandment screen, Joe, if that's possible. And Jaylene, I might get you to start to talk us through those demandments that the young people wanted.
Yeah, so one of the first amendments that we discussed was providing more education and support around mental health for young people, families and communities. So during that discussion, we didn't only talk about how it was important for the individual to educate themselves on mental health and if they have mental health issues or if their family has it. So it was real good to talk about how families should get educated and support in it. Just so that they could support each other. And it's also important for the community as well, like as a community, for us to all educate ourselves so that we can all support each other.
Yeah. It was interesting listening to a lot of the young people say how unless the families and the communities buy into it, then it's really hard for them. And so it needs to start with childcare, then move through the schools, the primary schools, the high schools, and then it's got to go and follow you after you leave those institutions. And I thought that was brilliant. Cool. All right, let's go to the second one. Portia, do you want to take us through just that one?
Yeah, raise awareness around the importance of returning to country. So it's things like connection to people and country. So like language, if you can speak the same language as someone, your better connections like your connections are better and more comfortable around it. So you're willing to share more, kind of. I don't know. Yeah.
No, it's brilliant. No, it's fantastic. And also, one of the people online shared that the managers of workplaces and need to be aware of how important that is, so that it can be incorporated into understanding and the way that we go to work and able to have time away to go back to country when necessary, which was really good.
Yeah.
The third point there, Jaylene, do you want to expand a bit more on that?
Yeah, so the third one up there we got is set up healing centres and programs that promote reconnection to culture, to country and culture. So when we discussed that, we just talked about how a lot of the youth, like, they feel lost, or they don't, like, you know, they might slip up or, you know, have some mental health issues that not being connected to the country and their culture, it doesn't help as much. Like, it just makes it a little bit more challenging for them. And I think having, we talked about having healing centres and programs that, you know, help them, like, just promote how important connecting to country and culture really is for our mental health.
Yeah, beautiful. And that was important that you said it all. It's a community thing. It's not just one age group, but it's all of us coming together and doing that, which was really, we all need to heal at times. And then there's the final one there, which I just found this incredible, because I was, you know, trying to be the government official and listening to the passion behind the raise the age. Do you want to just expand on that for us?
Yeah, so in our discussion, we talked about how raising the age of youth being sent to detention centres, because it's the age of 10 that's the youngest.
Yeah, if you're the age of 10, like, you could be sent to jail if you're like did something wrong, and like it's proven that your brain's not mentally mature until you're around 30. So the kind of question is like, why are you sending young kids to jail when they're not even making rational decisions?
Yeah, and a point raised yesterday was majority of the time the young people that are in detention centres are probably in there because of unhealed trauma, like intergenerational trauma. We also talked about that yesterday, and it's unhealed, and then sending them into a detention centre at the age of 10 isn't going to help them for the rest of their life, and that's just going to make mental illnesses that they may have more challenging for, and worse for them. So raising the age to at least, like, I think we talked about 16 yesterday, would, like, by the minimum 16. And I think that it, like, goes with the healing centres as well.
Yeah, spot on. It's interesting because there's actually a group over in Western Australia, Fish, that are doing some very interesting work around healing centres instead of prisons, and it's an interesting conversation. But I just want to just say how amazing you two are, how great you worked yesterday, and what a privilege it is to hear from you today. So thank you so much. And no worries. We're going to move across now to the group, which was the sexual health group. So Naya and Ashanti, you guys were in control of that one. So I'll get you to turn your camera on if that's cool, and just give us a little bit of an update on how that went yesterday.
Hi everyone, I'm Naya. Yesterday went really well. We had wait, can you guys hear me?
Yeah.
Okay, cool. It was a great conversation, and what flowed throughout was open and honest communication. I think that's what we had yesterday, which is great.
We might pull up the words out there and talk through a few of those.
So as you can see there, it's condoms, self-confidence, development, mental health. The big words are sexual health, stress, STIs, safe sex, consent, relationships, shame, and body image, and stigma, and misinformation, which also came up yesterday. You're on mute, Adam. Adam, you're still on mute. There we go.
There's that rookie. I was actually just saying this was so make sure you mute. There you go. It was really a great session today with the guys, and we might move across to commandments, because commandments here of what the young people wanted. Let's have a look at those. And
Shani, do you want to take?
So what we came up with was support school nurses to provide counselling and sexual health checks. So basically, we would have, like, you know, how schools have nurses and all that. Like, they would be, what's the word? Like, get the development, professional development, where they would learn about giving kids, like giving
the opportunity to go throughout school. We saw throughout the conversation yesterday that education was a big one, whether that's misinformation throughout all age groups or the timing. Like we found that clinics weren't open in the time that school finished, or they were closing, or young kids couldn't get checks in time, that sort of stuff. And we found also that teachers don't really have that basic kind of bare minimum knowledge of sexual health, and they don't really, I don't think they understand it as much as they should. And yes, having a nurse in the school can do well, and that can help, but say if a student doesn't feel comfortable going to that nurse, they could always go to a teacher, but if that teacher's not educated enough, then we can't really do much about it. So we think providing education and personal development, professional development, and providing counselling and sexual health checks is the way to go.
Brilliant, Naya. Just go to the next points there.
Sorry, you were breaking up, Adam. Just go on to the next one. So again, playing into the whole school education system, implementing a sexual and reproductive health day across all schools that are age appropriate and with all genders. We think that sexual health, the discussion should start at a young age, because it can happen at any age. People are constantly developing, and sexual age, we found that a lot of people felt pressure, and again, that stigma we began at middle school, but it can again start at any age. So we think implementing a sexual and reproductive health day across all schools was again a great idea to start doing. You're muted, Adam.
Sorry, guys, I get up all the time. Big Brother, I think once starts talking too much, they have to use obviously part of it. It's Gills, I'll just get you to continue that list and share those other points that you felt really.
Cool. Ashanti, do you want to read the next 2 points there for Adam and just sort of talk about what they're about?
So provide a 24/7 service app for survivors of sexual harassment and assault with follow-up sessions and links, train police officers. So basically, if, you know, sexual assault can happen any time of the day, instead of, you know, if it does happen, then you have someone to talk to and you're comfortable with talking to them, but also that person following up with you, whether it be once a month or once a week, you know, but also that person can choose when to be, you know, if they want, yeah, like, it's like they're in charge, and then also, yeah, so.
Sort of guiding their own sort of support.
Yeah.
Yeah, exactly. So the survivor can choose when they want to seek help, but they know that it's kind of taking control of your own health and your own story, but knowing that someone's there with you.
So that self-managed support, like we were talking about.
Yeah.
Exactly.
Brilliant. And we'll move on to the last point.
So yes, provide free pad. With free came up a lot because again, why not? Provide free pad and tampon dispensers at schools and universities, and free contraceptives in place for people that need them. It kind of gobsmacks me that this is still going and it's not happening already, but nobody chooses to go, well, women don't choose to go through what we have to go through every month. It's not something that we always enjoy. So I think having that option of free hygiene products is really great, especially at schools and university, because it does come at any time and anywhere. And with free contraceptives, again, it would be great because again, with those sexual harassment and assault issues as well, but also just, you know, being extra safe and with STIs and not everyone has enough money, and especially young people, as Emily touched on before with the COVID situation and the money, not everyone has money to buy contraceptives and stuff like that. So I think, great. Shani, did I miss anything?
No, you're right. You're right.
Thank you so much. Again, just such a both and fantastic work. And yeah, I got so much out of it. Really hope that this is really clear action, not words on it, but that it's actually going to. So that's great. Let's go to our third was access health and support that. That was done by Jade. So Jade, I'll get you to pull your camera up and pop your mic on, and I'll get everyone else to turn their mics off. You out there, Jade?
Yeah, I'm here.
Awesome, my brother. It was a great day yesterday, mate. You did some beautiful work with the crew, and they gave so much great feedback. Do you want to just give a brief rundown about it and have a look at that word cloud and share a little bit with us about it, buddy?
Yeah, we had a really good session with our committee members. So we started off from asking why is it important for access to health services. We went through icebreakers on solutions to that, and then we came to a discussion about demands and how do we meet those demands. So Josie, I don't know if you're there, but could you pull up the word cloud for us all to see kindly, please? Thank you. Right, so as you can see there, there's a lot of common themes and ideas that came up around this topic. So access to health services, meaningful engagement with youth. So actually educating them and making it fun and engaging way for youth to actually want to access these health services. Shame, trying to destigmatize the shame around accessing health services and why some people can see it as being vulnerable. It can look quite shame and can be frowned upon sometimes. Follow-ups, social media was a big theme that came up in our discussions. What are some better ways we can promote access to health services and through engagement of social media? Health literacy, outreach. So how can we access the limited health services in urban compared to remote settings? Misinformation, opportunities, and engagement, as you can all see there. You're on mute, brother. Rookie.
Sorry, buddy. I'm getting muted by the central big brother, so sorry about that.
All good.
One thing, mate, the stigma came up in those three groups, you know, the two before and this one as well. And I suppose the question and the thing that we want to know the answer to is, how do we normalise these things? How do we make mental health, it's okay to share about it? How do we make sexual health okay? How do we make it okay to go to the clinic? Like, these are big questions, and I feel like unless we start to do it as the adults, then it's very hard to sort of align it. But mate, I'll get you just to expand now on the demandments that you collected from the group.
Yeah, so I was really impressed with my group. Some interesting things came out of those discussions. So improving access to service demands. So our first demand we put there was provide transport. So having a bus to enable young people and their families to access health services. So same, trying to break down the stigma around accessing these health services. Some good ideas that came up was having a way of transport. So being able to pick up your family, the client who's accessing the health service, having their family there as a support, and having them travel in the bus with them to the health service, and having them as a moral support. So it sort of breaks down that stigma as well. There's I believe Shanley brought it up, and there was a program, I don't know if it was in Central, they actually started that, providing the bus to pick up family, and that's had some really good feedback come out of that, and it's sort of helped a lot of the clients and able to access those health services. So our next amendment was develop online health education, including prevention designed by young people. So again, using the online platform to educate young people around health literacy, health education, and allowing them to be a part of that co-design stage where they can, they're allowed to actually see what they want, what's the information that they want to see, and how is it going to improve their access to these health services. Our next amendment was create awareness about health services and promote them. So creating the awareness, whatever that may look like, it could be promoting it through the community, it could be promoting it through an online space, but creating awareness, making sure that these young people are getting their heads in that frame of mind to be thinking about those services that are provided and that they have access to out there. And yeah, if there's anything I'm missing, Adam, feel free to jump in.
Mate, one thing there with that creating awareness, we talked about how sometimes we create awareness in a very clinical way through the certain websites that don't necessarily get viewed by young people and so on. So how do we start to make this stuff cooler, a place to go and check stuff out rather than the clinical report? And I think there's a balancing act in that as well.
Yeah.
Yeah.
So our next amendment was enable culturally appropriate health services that embed interpreters, local knowledge, and place-based workers. So the discussion we had around that was creating infrastructures and place-based workers to be able to, for communities, especially in remote, to be able to develop and create their own health professionals. We also wanted to embed a lot of local knowledge and traditional knowledges like traditional healing mechanisms and things like that. We feel that there's a lot of cultural things that are missed in the access to health services demands, such as language. There's a lot of different language groups in the Northern Territory, and we feel we had a discussion around what that could look like, if it might be a conference or an online meeting or a module or something about how to create a resource around health literacy that can be used for local languages, and and how that can be translated through local knowledge. Our last amendment there was provide a clear statement about privacy and confidentiality when accessing health services. So again, confidentiality came up as a common theme throughout all the health priorities, and it's just making sure that we feel like our information is kept private, and that also falls underneath the stigma of accessing these health services for young people, and what's that information being used for, and making sure that it's kept secured and locked, that our information is kept private, and making sure that it's not shared among any other services that we do not authorize. Adam, if you want to sort of give a brief on any other key information that we had around the demands.
Mate, you've done an amazing job, and we've got about 5 minutes to do the wrap it all up, but just a massive congratulations, mate, on some beautiful work. Keep inspiring us all with your journey, mate. You're an amazing young man.
Yes, brother.
Thank you, buddy. We're going to go across to Ethan, who actually was looking after environment. So, Eth, I'll get you just to sort of share a bit about the day, the experience, but also the word cloud, and unpack that for us, mate. So, mate, just want to share a little bit about that word cloud that we'll pull up. We'll get Josie to pull it up just to share a bit about some of those important things that in regards to environment.
Cool. Yeah, some of the information that we all gathered from young people over the last few days, sort of like that, natural environment, climate change, obviously heating, rising sea levels, which wasn't put on there, pollution, physical health, and anxiety. So sort of that mental health as well. So sort of trying to, connect why the environment and health are related. So overcrowding, housing, so creates that that anxiety around the communities, tropical health, tropical diseases rather. So being able to break down what those connections are.
Brilliant. And there were some really knowledgeable people online. It was a pretty amazing session that you ran, Eth. I might just get you to just expand on the demandments that we got from the groups, mate. Have you got those there? We'll get Josie to pop them up just so you can have a look at them and talk us through them.
Definitely. Thanks, Josie. Are you able to bring those up for us? Awesome. So a few of the demandments there we've got. Just bear with me so I can see the full screen. So yeah, obviously stop investing in fuel and gas and fossil fuels immediately and start investing in renewable energies. Being able to protect our waterways from overdevelopment. Reduce our carbon footprint and set a date for carbon neutrality in the NT. Greater lobbying rather from the NT government, federal government, for increased awareness and improvement management of tropical diseases. Protecting natural diversity by investing in native animal breeding programs and pest control, as well as provide better housing and infrastructure in remote communities, and including renewable energies and resources and improved water supply. So there's a lot of different information that we and very broad information around that environment and linking that health, those health priorities to the environment.
Yeah. No, they were fantastic, Eth. And is there any more there that you want to expand on? Because we will move across to Renee shortly and just get a wrap up of what we're going to do with this now. But was there anything on that list in particular that you wanted to talk about, buddy?
Definitely the the infrastructure and housing, especially around the overpopulation, especially in communities, and that, and sort of being able to support not just our townships and cities, but also those remote communities, outstations, that do need that consistent infrastructure and how what's the word? That care and management, and not just be able to develop what that knowledge of out there as well. So it helps them upkeep and keep a healthy communities. and a lot of the diseases that we have in the Northern Territory and health problems are linked to, you know, the environment not being, you know, healthy, especially, you know, within communities. It's not just climate, it's not just, you know, the health of our natural resources, it's also the environment that we live in. If we live in a dirty environment, an unhealthy environment, it's going to reflect who you are as a human being, being able to, you know, your mental health, physical health, and your family environment. It can be very toxic at times. So if you're living in a toxic environment, you're going to be feeling toxic. You're going to be feeling sick, and that's going to reflect on you, your community, and the wider, just the wider community in general.
Yeah, and this has been an ongoing issue for a long time. You know, I know since I've been in the Territory, just always housing keeps coming up. So we wonder when we can really push a button on that and make that happen. But Eve, just a massive congrats on all your beautiful work, mate, and how you've connected with all the young people to gather those voices. The work that's gone in behind the scenes, the trainee program that you guys are involved in is just amazing at Menzies, and just a massive credit to you and to the team, mate. So well done.
Thanks, Adam. Thank you, everyone, for being involved today.
Cool. Well, we might chuck over to Renee now. So Renee Kirkham, who has done some beautiful work also with Josie and many others, Lydia, behind the scenes to make all this happen. So over to you, Renee.
Thanks, Adam, and thanks to everyone. Now, I'm mindful of the time, so I'm just going to get cracking. But before wrapping up this session, I just would really like to do an enormous shout out to all of the people who have made the 2021 Youth Health Summit possible. As many of you know, I was involved in the first summit in 2019, but I've been off raising a little human. But I definitely understand the huge amount of work required to pull off an event like this. What is incredibly exceptional is that in 1 week, the team have had to rework the entire program as a result of COVID, and I can't believe the huge amount of work that's gone into this. So a really special mention to the Youth Committee, Adam and Josie Povey, who I know have all been working tirelessly to pull this together. In fact, as you know, Josie's still in the background, making sure that things are continuing to run seamlessly. So a huge team effort, guys. Congratulations to you all, everyone involved. Back to business though, wrapping up this session. An interesting but perhaps not overly surprising outcome from this summit is that the 4 priorities that were raised in 2019 have not changed, which clearly signifies how deeply important these priorities really are to the health and well-being of our young people in the Territory, and how we've still got a lot of work to do to address them. And while these priorities have informed some of the work that many of us have been doing since the last summit, COVID definitely redirected many of our efforts during this period. And I'm really excited that the format of this summit has provided us, I'd say the older audience, unfortunately I have to put myself in that category these days, it's provided us with some really clear practical recommendations, what we've named the demandments or the demands, on how to address young people's major concerns around the factors that are impacting their health and well-being. And having observed the sessions yesterday and hearing young people's in-depth discussions around these concerns, their priorities and the formulation of their demands, it's been really clear that running across all of the priorities was the really important point that young people request that their support network, so this includes their families and their communities, are supported to better understand these priorities and the ways that they can better support young people to engage in the systems that they need to promote positive change. Let me use a quick example from sexual health to illustrate this point. So if sexual health has been a taboo topic for many generations and it's not something that parents feel comfortable talking to their children about, then young people are often left on their own, not having to find information and support that's relevant to them from other sources. Just imagine the rapid change that could happen if parents and families were equipped with the right information and had the confidence to support their children and young people with the right advice to promote positive sexual and reproductive health. So the theme rings true across all of the priorities, and what it highlights is that bringing everyone along together is so critically important. It's about working in partnerships to improve the health and wellbeing of our young people across the NT. Service providers, policymakers, researchers, parents, families, communities, young people themselves. We know that young people have the solutions, so let's be guided by these and walk alongside them to make the changes that they request, these demands, to improve the health and wellbeing of their generation and those to come. And whether this is appropriate or not, I've found a couple of words from Henry Ford, just to summarise, saying, coming together is the beginning, keeping together is progress, but working together is success. Thanks, guys.
Thank you, Renee, Adam, Portia, Jaylene, Naya, Ethan, Ashanti, and Jade. With all of the information that has been shared today, we have identified some key priority focus areas. Thank you also to all of our youth committee members. It's so important to hear from young people about what they need going forward. I'm sure you're all wondering what the next steps are going to be. We value your feedback, so following this Zoom session, you'll be sent an online link. We would appreciate you completing this to provide us with any feedback you have to give on today's session and the whole Youth Health Summit initiative as well. And as Renee mentioned, information provided through yesterday's workshop and today's online event will be developed into a report, and we hope this will help to advise, well, we hope this will advise researchers, policymakers, and health practitioners. Your recommendations is a part of the solution to improve health for young Territorians. I'm also excited to share that the first 6 episodes of the Menzies Youth Choices, Youth Voices have dropped and are now available on YouTube and Spotify. This series of podcasts from a range of relevant, amazing Territorians, and I, for one, who actually helped out with the interviewing, was completely blown away, and I know you guys will be too when you get to see them. So they can be found on the Menzies website, and we will also be sure to send you the links as more podcasts become available. So I recommend you jump online and have a listen to some incredible stories of young people and others that are making great contributions to youth health in the NT. A final sponsor shout out. Again, this event wouldn't be possible without support of your hosts, Menzies School of Health and Hot North, major sponsors, the Northern Territory Government, NTPHN, Bridging the Gap, and Ironbark Corporation, and our event supporters, Charter Air and CDU. Also, another big shout out to our youth subcommittee for helping make this event happen. Thank you for joining us for this online session. I'm Letitia Jeffrey, and it has been an absolute pleasure for me to be your host for the Menzies Youth Health Summit for 2021. Have a safe weekend, everyone.